Okay, so good evening, everyone, and welcome to our eighth or ninth module. And today we will be discussing the Haemophilus and the HACEK organisms. So, a little disclaimer, there are some sensitive photos that will be flashed in the screen later. So, this is only a part of our this is an educational purposes lang po, no? So please bear with me. And if you have any questions or clarifications, please do not hesitate to um, raise your hand so that I can entertain your questions. So let's keep the ball rolling. So the Haemophilus belongs to the Pastoralae family, and the genus Haemophilus derived from the Greek word hema and philos, which means blood lover. So these species are obligate, opportunistic organisms, and they can be found in the mucous membranes of both animals and humans. So they are normally inhabit or they normally colonize the upper respiratory tract of humans except the Haemophilus ducreyi. And most members of our Haemophilus um, are said to be fastidious. Again, what is fastidious organisms? These are organisms that requires a special nutrients and environment for them to thrive outside the body. Aside from being fastidious, they are non-motile and they are facultatively anaerobic bacteria. So, in addition for being fastidious, our Haemophilus species are that yes, nawala yung PowerPoint. Okay. So can you view na po my PowerPoint? All right. Thank you. Okay, so again, our Haemophilus species, they are very susceptible to drying and extreme temperatures, which makes them a fastidious organism. So always remember to use correct specimens, swabs and specimen criteria for suspected Haemophilus organisms. So generally, our Haemophilus are gram-negative pleomorphic, meaning to say, what do you mean by pleomorphic? It varies with size or shape, no? So, but most commonly, our Haemophilus are said to be cocobacilli or rods. Okay, so they are gram-negative cocobacilli or rods. And occasionally, they can be seen as long filaments with when the sample came from a pure colony isolate. So there are 8 species associated with humans. So they are the Haemophilus influenzae, Haemophilus parainfluenzae, Haemolyticus, Parahaemolyticus, Pitmaniae, Aegyptius, and Ducreyi. And your Parahaemolyticus. So most members of the genus Haemolyticus are non-pathogenic or may produce opportunistic infections. So your Haemophilus influenzae and parainfluenzae can cause respiratory illness, while your Ducreyi can cause a type of a soft skin tissue infection, which is a sexually transmitted infection, while your Aegypticus can cause an infection to your mucous membranes. So they constitute 10% of our microbiota of a healthy respiratory tract. So there is a high chance, or there is a chance or possibility that you can recover Haemophilus from respiratory samples. However, not all of them can cause or can be a true pathogen of your respiratory tract. So the major pathogenic species are the following. We have your Influenzae, Aegypticus, and your Ducreae. So since they are fastidious organism, they require the X and the V factor. So your X factor also stands for a hamine or hematine, while your V factor also stands for nicotinamide adenine dinucleotide. So these factors can be found in our chocolate agars. So on chocolate agars, our Haemophilus looks like a tan-colored colonies, and some of them could produce mucoid colonies with distinct odor. Okay, some of them also appear as a dry colonies on chocolate agar. Okay, so by the way, your chocolate agar doesn't contain chocolate, but they contain your X and V factor. For biochemical tests, for rapid identification of our Haemophilus species, so all of your Haemophilus species are catalase positive and oxidase positive except for Haemophilus ducreae. And all of them are nitrite reduction positive and glucose fermenters except for Haemophilus ducreae. Again, all Haemophilus species are gram negative coccobacilli or rods. They are catalase positive, oxidase positive, nitrate reduction positive, glucose fermenter except for Haemophilus ducreae. So the growth factors that they need are your X factor and your V factor. X factor is a heat stable substance, while your V factor is a heat labile substance. Meaning to say, your V factor is susceptible to heat, so it can be easily destroyed by heat. Almost all organisms will not grow in a pure culture on your sheep blood agar. Although your X and V factors are found in the red blood cells, but your X factor is only directly available. So the presence of your NADases in sheep red blood cells will hydrolyze the V factor needed by most Haemophilus organisms. That's why the agar of choice for Haemophilus would be your chocolate agar, since your X and V factor is readily available. Later on, I will be showing you a table so that it will be easy for you to digest and remember which species of Haemophilus requires the X and the V factor or requires both factors. So as I've mentioned in the presentation, the use of chocolate agar is for a high recovery of the organisms for clinical specimen, because we lyse the red blood cells in heat during the preparation of your chocolate agar. So the heat will release or will destroy your RBCs to release both the X and the V factor and inactivate the NADases. So there are some cases wherein an organism that grows on sheep blood agar that is capable of lysing the red blood cells. Okay, so your Haemophilus will grow around the colonies of this organism that can produce cytolytic toxins or enzymes. So this phenomenon is also known as the satellitism. Okay, because there are organisms that produce the V factor as a byproduct of metabolism. So what are these organisms that is capable of producing V factor? Hence, we can see a satellitism phenomenon. We have your Staphylococcus aureus, your Streptococcus pneumoniae, and your Neisseria species. Remember that your Staphylococcus aureus, they produce a beta hemolytic colonies on sheep blood agar, and they appear as a watery yellow colonies. While your Streptococcus pneumoniae produce an alpha hemolytic colonies on sheep blood agar, and they can produce a mucoid colonies on this type of agar. While your Neisseria um, can grow on your modified Thayer Barthene agar and some and chocolate agar as well. The difference with this type of agars, they are chocolate agar based, but they are supplemented or there are additional antibiotics to inhibit the growth of your gram-positive organisms as well as the yeast. Okay, so this is a photo that shows an image of an isolate of Haemophilus influenzae on sheep blood agar with a streak of your Staphylococcus aureus. So this is a satellitism phenomenon. Your Haemophilus species will grow near the colonies of your Staphylococcus aureus because your S aureus can lyse the red blood cells so that it can produce the V factor so that your Haemophilus will thrive on this type of agar. So there are selective mediums that can be used to rapidly isolate your Haemophilus species, and one of which would be the horse blood bacitracin agar. So this could be used for isolation of your Haemophilus influenzae from respiratory secretions of patients with cystic fibrosis. Okay, so this medium is designed to prevent overgrowth of your Haemophilus influenzae by mucoid Pseudomonas aeruginosa. Remember that Pseudomonas aeruginosa is one of organisms that can be isolated from patients with cystic fibrosis. But together with your Bucholteria, Cepacia, and your Stenotrophomonas maltophilia, we have your Pseudomonas aeruginosa. However, despite of being a gram-negative organism, your Haemophilus species will not grow on McConkey agar. Okay, they will not grow on McConkey agar. On the other hand, your Haemophilus ducreyi requires a special growth factors that can be found only on special media. Okay, so we have two. We have your Mueller-Hinton-based chocolate agar that is supplemented with 1% iso-BacteLEC and 3 milligrams per ml of vancomycin. Another would be your heart infusion-based agar that is supplemented with 10% fetal bovine serum and 3 milligrams per ml of vancomycin. Your vancomycin here will inhibit the growth of unnecessary gram-positive organism. While your fetal bovine and your 1% BacteLEC will supplement the required nutrients for Haemophilus ducreyi. Okay. So aside from the biochemical requirements of your Haemophilus, we also need to consider the incubation and atmospheric requirement. Remember during the exam, during the midterm exam, I have one question there. I ask you, what is the reason behind why there is no growth, of an organism despite of incubating it after 48 hours. Okay. So the correct answer there would be there should be a correct atmospheric requirement. Okay, atmospheric requirement. Because if the organism is an anaerobic organism, you have to incubate it using a candle jar or a specialized jar that will give an anaerobic environment. Okay, and most of your pathogenic organisms are or can thrive at um, um, a normal atmospheric requirement, wherein we have your nitrogen, and oxygen and nitrogen, as well as carbon dioxide. So most strains of Haemophilus species will grow aerobically and anaerobically because they are facultative anaerobes. Therefore, they can grow with or without the presence of oxygen. And the growth is stimulated by 5 to 10% of carbon dioxide. Therefore, it is recommended that the cultures suspected with Haemophilus should be incubated using a candle jar. Okay? Or a jar that contains a CO2 pouch or CO2 incubator. And these organisms will grow within 24 hours, but cultures that are routinely held up to 3 days or 72 hours before being discarded as negative. Because in reality, in the clinical setup, we incubate most of our specimens will be incubated up to 48 hours before we consider it as a negative or declare it as a negative or no growth after 48 hours. But there are some clinicians that will give you an instruction to incubate or extend the incubation period up to 5 days or 7 days if they suspect a slow grower bacteria. Usually, these are HACEK under the HACEK group. No? But there is an exception to the rule, which is your Haemophilus ducreyi that requires as long as 7 days to grow. Okay, so let's have a recap. Let's have a recap. So as I've mentioned earlier, all Haemophilus species are catalase positive, oxidase positive, can nitrite reduction positive, and glucose fermenter, except for Haemophilus ducreyi. Okay, but in terms of incubation period, it's your Haemophilus ducreyi that requires up to 7 days of incubation. Okay, so optimal growth of your Haemophilus species occurs at around 35 to 37 degrees Celsius, which is a normal body temperatures. However, there is an exception to the rule. Again, it's your Haemophilus ducreyi. So your Haemophilus ducreyi should be incubated at a lower temperature, which is 33 degrees Celsius. And it requires a high humidity. Okay, therefore, we have to put a sterile gauze pad that is moistened with a sterile water inside the candle jar or the CO2 pouch or a CO2 atmospheric chamber for you to successfully isolate a Haemophilus ducreyi. Okay. So this table shows you the organism and their expected appearance on chocolate agar. Okay, most of your Haemophilus and HACEK can be isolated from chocolate or can grow on chocolate agar, except for your Haemophilus ducreyi. Because we require your 1% isobutalics and your 10% bovine albumin for your Haemophilus ducreyi. Okay, kindly study or kindly read this table. So this is a photo of an isolate of Haemophilus on chocolate agar. So it is described as a tan-colored colonies. Okay, I've already isolated Haemophilus influenzae in the laboratory, and as I remember, there is a odor, no? There is a specific odor that I can smell when there is a suspected Haemophilus um, isolate. It's like a bleach-like odor, okay? Amoy Zondrox, okay? Si Haemophilus influenzae or the Haemophilus species. So you have to scan thoroughly the chocolate agar, especially when you are handling respiratory samples such as your sputum, your endotracheal aspirates, pleural effusion or pleural fluid, or anything from the respiratory tract, because your Haemophilus influenzae is a culprit of um, upper respiratory tract infection. Okay. On gram stain, okay, as you can see, they are gram-negative coccobacilli or rods, and they can produce capsule. Okay, your capsule, this is a type of set of a cellular appendages that helps the Haemophilus influenzae to evade the immune system because it resists phagocytosis. So, if you are lucky enough to see this under the microscope, you can see a capsule even though you use the routine gram stain reagents, because it demonstrates a halo or clearing of zone around the organism. But you may also use acridine orange or methylene blue to stain Haemophilus species. So this image on the right side, it depicts a um a gram variable, reaction. So what happens when you produce a gram variable reaction of gram staining? So one of the reasons why you produce a gram variable reaction is that you use an old specimen, okay, an old specimen, because the cell wall of the bacteria or the organism is already susceptible to the stains, and it is the cell wall is already disintegrated, no, it's not intact anymore, therefore it can stain with your safranin and with your crystal violet. Therefore, it produces a gram variable reaction. Some of organisms produce gram positive, some of them produce a gram negative reaction. So the troubleshooting there is to use a fresh sample. Okay, ideally within a 24-hour old sample. Okay. So your Haemophilus ducreyi can be uh, can produce a school of fish or railroad tracks or a fingerprint reaction or arrangement during gram staining. Okay, so they are gram-negative coccobacilli, but they arrange according to groups or singly. So we refer it as a school of fish, railroad tracks, or fingerprints. So the image shows this type of arrangement. Okay. Now let's talk about the one of the pathogenic species of Haemophilus, which is your Haemophilus influenzae. It is also known as the Pfeiffer's bacillus, and it was named during the pandemic that spans around 1889 up to 1890. Okay, so this is an influenza pandemic. Okay, so this Haemophilus influenzae can cause meningitis in children. Please remember that. And this can be spread from nasopharynx and the regional lymph nodes to the blood and meninges. Okay? That's why it can cause meningitis in children. So the mode of transmission would be air droplets. So it is very fastidious but can be rapidly killed by phagocytes, your Haemophilus influenzae. Therefore, your Haemophilus influenzae produce this type of virulence factors. We have your capsule, IgA proteases, adherence by fimbriae and other structures, and the presence of outer membrane proteins and lipopolysaccharide. Because the capsules will help the organism to evade the immune system and plays a significant role in its pathogenicity. So, by the presence of the capsules of your Haemophilus influenzae, this can be used to group your Haemophilus by using serologic techniques. Okay, because we detect the polysaccharide structures to produce a 6 distinct types, which is the following: A, B, C, D, E, and F. So, your Haemophilus influenzae infection um, can be prevented by the use of vaccine. However, in with from the previous years, no, during the when the vaccine is not yet available, the most common serotype of Haemophilus influenzae that cause infections in humans would be the serotype B. And primarily, it can be found in young children, which causes meningitis. Okay? So the geriatric population is also susceptible to Haemophilus influenzae. And the children is said to be the carriers of these organisms. So what is the special characteristic of a serotype B capsule? So it contains a polymer of ribose, sorbitol, and phosphate that makes it unique. And it has an antiphagocytic property and anti-complementary activity, which is important for its virulence. Remember that your complement system is also a way of your body to dispose or attack or eradicate the pathogens. Next would be the infections caused by Haemophilus aegyptius. Okay, so this is also called as the Cockwicks bacillus, and genetically it is related to Haemophilus influenzae. Okay, they just differ in some biochemical reactions, and this was observed by Robert Koch from the exudates of conjunctivitis from Egyptians, which is recorded during or from 1883. So your Haemophilus aegyptius can cause the pink eye, okay, because it produces conjunctivitis. This is an acute contagious inflammation of your eye mucous membrane. The Haemophilus aegyptius can also cause severe systemic disease, which is known as the Brazilian purpuric fever. So most commonly, the peak of this type of infection is during hot climates. If you can observe, no, during summer, there is a high chance, or there are some cases of conjunctivitis. And one of the culprit behind the conjunctivitis would be the Haemophilus aegyptius. But your Brazilian purpuric fever produces conjunctivitis, produce fever or high-grade fever with vomiting. And this is the distinct characteristic of Brazilian purpuric fever. The patient produce purpural rash or petechiae. Okay, so there are some blood clots found on the skin, and in some cases, this could lead to bacteremia or septicemia, and eventually can cause shock and eventually death. Next would be your Haemophilus ducreyi. Okay, your Haemophilus ducreyi is an agent of chancroid, which is a highly communicable STD, and this can be found in the genitals. No, it produces a genital ulcer. So it infects the mucosal epithelium of the genital and non-genital skin, and it can affect the regional lymph nodes. Okay? So your Haemophilus ducreyi is associated with soft chancre. Again, soft chancre kasi meron din po tayong hard chancre. No, may hard chancre din. The hard chancre is associated with syphilis. But for Haemophilus ducreyi, it's the soft chancre. So, your Haemophilus ducreyi is the only asaccharolytic member of the Haemophilus family. What do you mean by asaccharolytic? It doesn't need any um, carbohydrates for them to thrive. No? May kakaiba silang requirements for them to grow. And the characteristic of your soft chancre would be it produce a painful, tender genital lesions that advance to ulcers, or there is an ulceration, no, with satellite lesions. So the hallmark of the Haemophilus ducreyi infection would be the presence of the chancroid, as well as production of bubobs or suppurative and large inguinal lymph nodes. Okay. This type of organism has an incubation period of 4 to 14 days. Okay? 14 to 14 days. So this is a photo of a soft chancre caused by Haemophilus ducreyi. So as you can see, it produces a lesion, no, on the male genitalia. Okay. So if you can see or if you can encounter this type of chancre in the near future and the doctor requires you to collect sample for routine culture and sensitivity and gram staining, the method of collection for this type of ulceration would be you have to collect directly from the ulceration. Okay, so here, no, as you can see, there is a distinct margin of the ulceration. So you take a sample, no, from this area, no, around the area of this margin. Okay, so ito yung target site ninyo of collection. It could be painful for the patient, but please inform them right ahead that there would be a stinging sensation or it could be painful, but please bear with while collecting. So there are some miscellaneous species for your Haemophilus. We have your parainfluenzae, which is found in the oral cavity and produce a very low incidence of pathogenicity. However, if the patient is immunocompromised, it could produce a infection. And this could be implicated to cause endocarditis, or it can affect the middle valve of the heart. Okay. So another striking characteristic of your parainfluenzae would be it is a strong carbohydrate fermenter. Okay, it ferments glucose, fructose, sucrose, and maltose. But on agar, it is non-hemolytic. Okay? It requires only the V factor, your para-influenzae. Okay. Now let's take a look at the laboratory approach for your Haemophilus species. So to test for what kind or those to have a presumptive identification of your Haemophilus, no, we can use your X and V factor requirement. So we use a strip embedded with an X and V factors, and we inoculate the target organism, and we put an impregnated disc on it. So if the organism requires only X factor, the organism will grow around the X strip. But if the organism requires only V factor, again, the organism will grow around the V factor. So typically, it produces a satellitism phenomenon on around the strip, no? The only thing about here is we use a chemically derived X and V factor. Kasi kanina, we use organisms such as your Staphylococcus aureus, your Streptococcus pneumoniae, or Neisseria species to produce these factors. But if both organism requires X and V strip, they both grow around the X and V impregnated discs. So you may read through the procedure of the X and V strip for the laboratory approach. Okay, as you can see here, you can read through. Very easy to understand. So this is a photo or an image of the X and V factor test. So please remember that when performing this type of test, it is essential not to transfer any chocolate containing or blood containing medium to prevent a carryover of the factors that could lead to false results, no? So ideally, we use a Mueller-Hinton agar for this type of test. So you can see walang chocolate, we do not use chocolate agar here. We just use a Mueller-Hinton agar, and we inoculated using the lawn stick technique, no, and then we impregnate the disc. So this is a table that shows you the requirements of each species of Haemophilus. So both X and V factor is a requirement of your influenzae, Aegypticus, and Haemolyticus. Please remember that. And all species that starts with, or the species that starts with the word para, that only requires V factor. Okay? Para Haemolyticus, para Haemolyticus, para influenzae, they only require V factor. With exemption to your HACEK guineas, no? While your H. ducreyi only requires the X factor. Okay? Lone species of Haemophilus that requires only the X factor. Next laboratory approach would be your porphyrin test. Your porphyrin test. So the porphyrin test is also known as a delta aminolevulinic acid test. So it detects the presence of bacterial enzymes that converts the ALA or the delta aminolevulinic acid. I think you already encountered this in hematology 1, no, during the types of anemia, no. It converts the bacterial enzyme produced by the Haemophilus, converts the ALA or the delta aminolevulinic acid into porphobilinogen or porphyrin. and it identifies the heme-producing species of Haemophilus. So it can be performed in broth, solid medium, or by using an impregnated disc with reagent. No? So what is the reagent? It's the COVAX reagent or the p-dimethyl aminobenzaldehyde. And the substrate would be the delta-aminolevonilic acid. So what is the end product of the porphyrin test? No? We have your porphobilinogen that produce red color and your porphyrins that produce a reddish-orange color at 360 nanometers using the ultraviolet rays. Okay. So the positive result would be red color. So what is the expected species that produce positive in porphyrin test? We have your H. para-influenzae, H. para-hemolyticus, H. Para parohemolyticus, parapyrophilus, and the H. aprophilus. For the negative porphyrin test, there is no color change, no, upon adding of your COVAX reagent, and the expected organisms that produce a negative porphyrin test are the following: your H. influenzae, H. hemolyticus, H. aegyptius, and H. ducreyi. So this is an image that shows you the porphyrin test. So the positive outcome would be the red color, no? If it could be by using of impregnated disc or by tube method or by the solid agar. So remember, you need to use ultraviolet rays at around 360 nanometers to produce this type of reaction. Okay. So another table to be studied, no, inad ko lang po, I just added the porphyrin test. So as you can see, all species that requires the V factor is positive to porphyrin test. Okay. So there are some additional notes that you may scan or that you may read, no, to supplement the study of Haemophilus species. You may read through this specific note. And this is the carbohydrate reactions or carbohydrate requirements of each species of Haemophilus. Most of them are glucose fermenter, except for H. ducreyi. No? As you can see, negative po lahat. There is a negative reaction for all carbohydrates for H. ducreyi because H. ducreyi is asaccharolytic. So before we go to the HACEK group, for antimicrobial susceptibility test of your Haemophilus species, okay, since this is a fastidious organism, it is we have to determine the beta-lactamase activity of your Haemophilus species. And your Haemophilus influenzae is usually susceptible to the following, to erythromycin, while your Haemophilus test medium or the HTM is utilized for this assay. So when you want to perform an antibiotic susceptibility test, you have to use the Haemophilus test medium or Haemophilus test medium agar to demonstrate the susceptibility test against erythromycin. But if there is a life-threatening condition such as meningitis caused by H. influenzae, you may use cefotaxime and ceftriaxone, which is a fourth generation cephalosporin to treat H. influenzae, as well as amoxicillin clavulanate or tri, trimethoprim sulfametazole for other non-life-threatening infections. But for Haemophilus ducreyi, you may utilize azithromycin and or ceftriaxone to eradicate H or to treat H. ducreyi infection. Aside from the traditional um, techniques for isolating Haemophilus species, we can also utilize molecular techniques to rapidly identify your H. influenzae by using polymerase chain reactions. Okay, so we detect the HPD, okay, the HPD gene and the FUCK. Okay, hindi po I'm not saying a bad word, but it's the FUCK or the fuculose kinase. Fuculose kinase gene. Okay, so that are the HPD gene, and the FUC gene is used for rapid molecular techniques. Okay, let's now proceed to your HACEK group. Okay, so your Haemophilus is a member of your HACEK group. Okay, so remember when dealing with HACEK group, these are group of bacteria that are known to be fastidious organism. They are gram-negative bacteria. So what are the members of HACEK group? We have your Aggregatibacter actinomycetem comitans, formerly known as the Actinobacillus. We also have your Cardiobacterium hominis, Echinella corrodens, as well as the Kingella species. So most members of the HACEK group requires 5 to 10% carbon dioxide. Therefore, they are capnophilic organisms and they are slow growers. They grow slowly, and they could be considered as a normal flora of the oral cavity. However, your HACEK group can be considered as opportunistic pathogens. They are pleomorphic, non-motile, and they do not grow on McConkey agar. The members of the HACEK groups are glucose fermenter except for Echinella corrodens. Members of the HACEK group are glucose fermenters except for Echinella corrodens. As I've mentioned earlier, HACEK group or the H. ducreyi requires 7 days, no? But for the HACEK group, some of them requires up to 7 to 14 days of incubation. But when dealing with blood culture bottles or blood cultures, they produce a significant growth after 5 days of incubation. Therefore, when collecting for blood culture, you need to utilize both the aerobic and anaerobic bottles. Your HACEK group can cause slow and progressive bacterial endocarditis. Okay, they target the mitral valve of the heart. No, so most members of the HACEK group is associated with bacterial endocarditis. And the organisms can utilize the delta aminolevulinic acid. Okay, so this This table shows you a summary key reactions and striking characteristics of your HACEK blood group, HACEK organisms. No, we have your aggregatibacter Aprophilus. So the colony morphology, it is raised, convex, granular, and yellowish in color. It is a glucose fermenter, but catalase negative, while your aggregatibacter actinomyces is positive to catalase. So if the question is what biochemical test is used to differentiate A. Aprophilus from A. actinomyces, the answer would be catalase test. Okay. Aside from catalase test, we also have your sucrose and lactose, because your aggregatibacter actinomyces is negative or cannot ferment sucrose and lactose. Your Cardiobacterium hominis produce a smooth opaque colonies that is adherent to the agar and produce a spindle or rosette reaction or arrangement on gram stain. It is indole positive and catalase negative. Echinella corrodens, from the word corrodens, it pits the agar or corrode the agar. No? Kinokorrode po ang agar. Again, catalase negative, negative to sucrose and lactose, and negative to, and smells and produce a bleach-like odor. Another striking characteristic of your Echinella corrogens is ornithine positive. Okay? Ornithine positive. Kingella kingae. Kingella kingae produce a beta hemolytic colonies. It is nitrite negative and catalase negative. Capnocytophagia produce a flat colonies, irregular in shape, and may appear purple colonies. Okay, purple colonies, variable reaction in esculin test, but it is known as a glucose fermenter, but negative to oxidase and catalase. Okay, now let's talk about your aggregatibacter Aprophilus. So this is the most prevalent species among the HACEK group and does not require carbon dioxide. It is normally found on dental plaque and gingival scrapings, and patients with this type of infection produce fever, heart murmur, congestive heart failure, and embolism. So the striking characteristic of your aggregatibacter Aprophilus, by studying this one, no, it is a strong carbohydrate fermenter kasi nga po, it is capable of fermenting these 4 types of sugars. It is a positive in nitrite reduction and X-factor dependent. Next would be the aggregatibacter actinomyces. It is a common cause of periodontitis. It has been isolated with polymicrobial infection together with actinomyces, which is a different type of bacteria. The virulence factor of your aggregatibacter actinomyces are the following. We have your collagenase and leukotoxin. So it is the only catalase positive HACEK species. On brain-heart infusion agar, A. actinomyces produce a star shape. Again, in brain-heart infusion agar, the colonies of your A. actinomyces produce a star-shaped centers after 48 hours of incubation. But on blood agar, it produces a sticky with greenish appearance. Resistance pattern of your A. actinomyces. This resistant to ampicillin. Okay, ampicillin, resistant to ampicillin. Isolates are generally susceptible to aminoglycosides. Okay, what are the example of aminoglycosides? We have your gentamicin and amikacin. Gentamicin and amikacin, aminoglycosides. Third generation cephalosporins. We have also your quinolones, okay, or your fluoroquinolones, examples of which are your ciprofloxacin and your levofloxacin, chloramphenicol, which is a not so good type of antibiotic because it can cause um, hematological problems. And we also have your tetracycline. There is a high resistance pattern against vancomycin and erythromycin. And the usual treatment for this type of infection is by the use of penicillin and aminoglycoside. Next would be the Cardiobacterium hominis. Okay, Cardiobacterium hominis is a pleomorphic non-motile fastidious gram-negative bacteria that is a part of normal flora of your upper respiratory tract, okay, including the mouth, throat, and the nose. But it could be also present in the gastrointestinal tract. It mainly affect the aortic valve. Okay. It affect aortic valve, no? As you can see naman, cardiobacterium. So, this is associated with heart, no? Heart infection. So gram stains of Cardiobacterium hominis often show a false gram-positive reactions. And these organisms produce rosette, swellings, long filaments, or stick-like structures when using a yeast extract. They grow slowly on sheep blood agar and chocolate agar and requires 5% carbon dioxide. Next would be your Echinella corrodens. Echinella corrodens is the least common isolate. Again, least common isolate among the HACEK group. And this is the only member of the HACEK that is asaccharolytic, no? Aside from H. ducreyi, Echinella corrodens is also asaccharolytic. It causes various infections such as clenched fist injuries, and skin infections due to human bites. Okay? Human bites. So, sino ba naman ang kakagat? No? Or there is a fist fights, no? The patient can develop Echinella corrodens infection when you bite your when you are bitten by another human. Since Echinella corrodens is also a part of the upper respiratory tract or or the mouth, no? Cultural characteristics of Echinella corrodens, aside from giving off a pitting of the agar, okay, pitting of the agar, it produces a sharp bleach odor, a yellow colonies with fuzzy edge, and it is positive to oxidase and ornithine decarboxylase. So it is reported to cause periodontitis, meningitis, empyema, pneumonia, arthritis, post-operative tissue infections, as well as osteomyelitis. Okay, so this is a photo of a corroding of or pitting of the agar, no? It produces a depression on the surface of the agar. and there is a strong bleach-like odor on the on the agar, no, or you by when using chocolate agar. Next, we have your Kingella. Kingella. So on microscopy, they produce a square-ended, plump, gram-negative rods and they are typically arranged in pairs or in short chains. So the major pathogen associated with Kingella, there are several species kasi of Kingella, but the most pathogenic would be the Kingella kingae. Kingella kingae. So your Kingella is also belongs also to the family of Neisseria. Therefore, it can grow to Neisseria selective agar such as your MTM or your modified Tiger Martin. Okay? Your Kingella and Echinella, they are both under the family of Neisseria. So therefore, they can be isolated using modified Tiger Martin or your Neisseria selective agars. However, your Kingella cannot pit the agar or it cannot corrode the agar. So please take note that the Kingella can colonize upper respiratory tract, especially the tonsils, and the viral infections can be precursor to infections by these organisms. And you can acquire Kingella when you have a poor dental hygiene or oral surgery is associated with infection. Okay. If you did not develop a habit of maintaining a good hygiene, therefore you can acquire this type of infections. Okay. Striking characteristics of your Kingella kingae quickly ferments glucose and maltose, but negative for sucrose. And there are two types of colony morphology. First would be a corroding colony or smooth convex. Second would be production of beta hemolytic colony that usually occurs after 24 to 48 hours of incubation. And they can grow on Thayer Martin agar and can be mistaken as Neisseria gonorrhoeae. So how can we differentiate your Kingella denitrificans from Neisseria gonorrhoeae? Your Kingella denitrificans is positive to nitrite and it is positive to indole. These are nice to know, no, for laboratory identification. Next would be the capnocytophagia. Capnocytophagia is a facultative anaerobe that requires an increased carbon dioxide for growth, therefore capnophilic, and can be isolated from blood cultures. They often produce a thin or fusiform pointed edge resembling Fusobacterium species, which are spindle-shaped, coccoid, and curved filaments. Capnocytophagia can produce gliding motility. Okay, this is a recall questions from the recent board exams and ASCPI. Capnocytophagia produce a gliding motility on solid agar, no? And they produce a yellow-orange pigment that resembles Echinella corrodens. However, most of your capnocytophagia isolates are known to be non-hemolytic except for Capnocytophagia hemolytica, which is beta hemolytic. There are 5 species under Capnocytophagia that is considered as a part of the normal oral flora, and all of them are oxidase and catalase negative. Antibiotic pattern, Capnocytophaga is susceptible to imipenem, erythromycin, clindamycin, tetracycline, chloramphenicol, quinolones, and beta-lactams. But they are resistant to aminoglycoside. Again, what are the examples of aminoglycoside? Your amikacin and gentamicin. Capnocytophagia canemorius can cause fulminant or life-threatening infection in humans after a dog or cat bite. Please remember po that. Capnocytophagia, dog or cat bite. Okay? So I think that ends or that concludes our discussion for Haemophilus and the HACEK organisms. So to wrap up, no, they are again your HACEK organisms, including Haemophilus. They are fastidious organisms that require 5 to 10% carbon dioxide, and most of them are slow growers and requires a lengthy incubation period using a carbon dioxide enriched jars or atmospheric conditions. And most of the members of your HACEK group is associated with endocarditis, but your Haemophilus produce infections um, for respiratory tract infections, except for Haemophilus ducreyi that is considered as a sexually transmitted infection because of production of a soft chunker, which is a hallmark, no, as well as the production of bubobs, no, and the inflammation of the inguinal lymph nodes. Your Haemophilus ducreyi is considered as a saccharolytic, as well as your Echinella corrodens, a saccharolytic. What do you mean by a saccharolytic? They cannot or they do not need carbohydrates to survive. Okay? They produce a negative reaction to carbohydrate fermentation tests. Again, remember, HACEK group, most of them are glucose fermenters. Most of them are glucose fermenters. Okay, so at this point of juncture, is there any questions or clarifications po? Okay, so please prepare for a quiz next meeting on Wednesday. So the topic or the subject would be around HACEK and the Haemophilus. So I think our class for this semester or for this month will be up to December 15 before the Christmas break. So I think we have to utilize the remaining days to cover the remaining topics for the final term. Okay, please study well for the final term because this is a make or break period for this semester. And I hope that most of you will endure the excruciating requirements of studying bacteriology, but please do not lose hope. I know there are so many ideas and key concepts when studying bacteriology, but one of the techniques that I've used to pass the board exam, the international certification, as well as in the real laboratory job is to read the books, reread the books, master the key concepts, and again, repetition of key concept. Kasi if you tend to repeat the key concepts, there is a high chance of retention. Do not use short-term memory when dealing with bacteriology because I'm not a fan of a short-term memorization, no. So kindly focus on the key concepts and do repetitions for you to be able to to pass the clinical bacteriology. Okay? So that concludes our discussion today. Thank you so much for attending the class. And again, please study well for the upcoming quizzes and exams. All right. Thank you. Ay, before we end pala, sorry, can we take a photo because I have to document. Okay. Let me just by the way, have you seen your grades, no? Um Nag-adjust na po ako sa grades ha. Adjusted na po iyon. Ginawa ko na po ang lahat para hindi siya magkaroon ng red carpet. Okay, I'm just taking some photos. Please bear with me. Okay, that's all. Okay, thank you. You may now take off your cameras. Again, once again, thank you for attending the class ha. I shall see you all on Wednesday. Thank
Thank you
you.
po, sir.
You're welcome.
Thank you po, sir.